Ginger, a versatile rhizome known for its distinctive flavor, has long been revered for both its culinary and medicinal attributes. Whether enhancing the taste of dishes or serving as a key element in traditional remedies, ginger has gained recognition for its manifold health advantages. Abundant in bioactive compounds like gingerol, it possesses anti-inflammatory, antioxidant, and anti-nausea properties. Despite its widespread acclaim, it's essential to acknowledge that ginger is not a universal remedy. While many can safely enjoy its benefits, there are specific health conditions that warrant caution. In this video, we'll explore 8 health issues that underscore situations where ginger consumption may be inadvisable. By grasping these intricacies, individuals can make informed decisions about whether to incorporate ginger into their diet, particularly if they are contending with specific health concerns. Number 1. Bleeding disorders. Bleeding disorders encompass a range of conditions that affect the body's ability to form blood clots appropriately. Ginger, known for its antiplatelet properties, may interfere with the normal clotting process. Platelets are small cell fragments in the blood responsible for clot formation, and while ginger's antiplatelet effect is often seen as beneficial for cardiovascular health, it can pose a challenge for those with bleeding disorders. When individuals with bleeding disorders consume ginger, it may heighten the risk of prolonged bleeding or bruising. This is especially concerning for people with conditions such as hemophilia, where the blood lacks sufficient clotting factors. Ginger's natural compounds, like gingerol, can inhibit platelet aggregation, potentially exacerbating bleeding tendencies in those already predisposed to such issues. For those on anticoagulant medications, which are commonly prescribed to manage bleeding disorders, ginger's interaction can further complicate matters. Combining the effects of these medications with ginger's natural properties may lead to an increased risk of bleeding episodes, emphasizing the importance of caution and consultation with healthcare professionals. Number 2. Diabetes. Diabetes, a metabolic disorder characterized by elevated blood sugar levels, affects millions worldwide. While ginger has been lauded for its anti-inflammatory and antioxidant properties, its interaction with blood sugar levels raises concerns for those managing diabetes. Research suggests that ginger may have hypoglycemic effects, meaning it can lower blood sugar levels. For individuals with diabetes, especially those on medication or insulin to control their blood sugar, this property of ginger necessitates careful attention. Consuming ginger alongside diabetes medications may result in an excessive reduction in blood sugar levels, leading to hypoglycemia. Ginger's influence on insulin sensitivity further complicates its suitability for individuals with diabetes. While some studies indicate potential benefits in improving insulin sensitivity, the variability in individual responses must be acknowledged. Factors such as the type and severity of diabetes, as well as the presence of other health conditions, can influence how ginger interacts with the body's insulin response. Number 3. Gallstones. Gallstones are solid particles that form in the gallbladder, a small organ responsible for storing bile, a digestive fluid. Ginger, often praised for its digestive properties, can inadvertently affect the gallbladder and pose challenges for individuals with existing gallstones. Ginger stimulates the contraction of the gallbladder, potentially increasing the risk of discomfort or complications for those with gallstones. The contraction of the gallbladder is a natural response to the ingestion of food, aiding in the release of bile to facilitate digestion. However, for individuals with gallstones, this process can be problematic. Gallstones, typically made of cholesterol or bilirubin, can obstruct the normal flow of bile. When ginger induces gallbladder contractions, it may trigger the movement of these stones, causing pain and discomfort. This is especially pertinent for individuals with symptomatic gallstones, where the risk of complications is higher. While some argue that ginger's potential to prevent gallstone formation could be beneficial, caution is advised. The dynamic nature of gallstone development and the diversity of individual responses to ginger underscore the need for personalized guidance. Number 4. Heart conditions. Ginger is often praised for its potential positive effects on heart health, including its ability to lower cholesterol and improve blood circulation. There are nuances that warrant consideration, especially for those with heart conditions. One of the key concerns revolves around ginger's impact on heart rate and blood pressure. Ginger contains compounds that may influence these vital cardiovascular parameters. While some studies suggest a potential lowering effect on blood pressure, the variability in individual responses, and the potential for interactions with heart medications make this a complex consideration. For individuals with heart conditions, such as arrhythmias or hypertension, the dynamic nature of ginger's cardiovascular effects poses challenges. Ginger's ability to influence blood clotting, while potentially beneficial in preventing cardiovascular events, can also be a concern when coupled with certain heart medications that affect clotting mechanisms. Number 5. Allergies. Ginger allergies are relatively uncommon, but they do exist. The symptoms of a ginger allergy can range from mild to severe and may include skin reactions, digestive issues, respiratory problems, or, in rare cases, anaphylaxis. Skin reactions can manifest as redness, itching, or hives, while digestive symptoms may include nausea or abdominal discomfort. Respiratory symptoms can range from nasal congestion to more severe conditions such as wheezing or difficulty breathing. It's important to note that an allergic reaction to ginger is not necessarily linked to its consumption in culinary dishes, but is more likely associated with higher concentrations found in supplements or extracts. Therefore, individuals with a history of allergies, particularly to plants in the Zingiberaceae family, to which ginger belongs, should approach ginger consumption with caution. For those aware of their ginger allergy, the key lies in vigilant label reading. Many packaged foods and beverages, as well as herbal supplements, may contain ginger or its derivatives. Recognizing and avoiding these products is pivotal in preventing allergic reactions. Cross-reactivity is another aspect to consider. Individuals allergic to other plants, like turmeric or cardamom, may be more prone to developing a ginger allergy due to the botanical relationship between these spices. Number 6. Surgery. Ginger's role in surgery-related concerns revolves around its ability to influence the coagulation cascade, the intricate series of events that lead to blood clot formation. The bioactive compounds in ginger, particularly gingerol, possess anticoagulant properties, meaning they can impede the normal clotting process. For individuals scheduled for surgery, the last thing they need is a complication arising from excessive bleeding during the procedure. Ginger's anticoagulant effects can potentially prolong bleeding time, posing challenges for surgeons attempting to control and manage bleeding during surgery. To mitigate these risks, it is often advised for individuals to cease ginger consumption well in advance of their scheduled surgery. The time frame can vary based on factors such as the type of surgery and the individual's overall health. Generally, a few weeks prior to the scheduled procedure is considered a prudent window for discontinuing ginger intake. Patients are encouraged to communicate openly with their healthcare providers about their ginger consumption habits. This ensures that the medical team is well informed and can make necessary adjustments to the preoperative plan. In some cases, healthcare professionals may recommend alternative approaches to managing specific health issues that ginger would typically address. It's essential to recognize that the potential risks associated with ginger in surgery are not limited to oral consumption alone. Ginger supplements, which can be highly concentrated, pose an even greater risk of exacerbating the anticoagulant effects. Therefore, patients are often advised to discontinue all forms of ginger, including supplements and extracts, in the lead-up to surgery. Number 7. Acid reflux. Acid reflux, a common digestive ailment, occurs when stomach acid flows back into the esophagus, causing a burning sensation and discomfort. Ginger's dual nature becomes apparent in the context of acid reflux. On one hand, it possesses anti-inflammatory properties that may alleviate gastrointestinal irritation, but on the other hand, it has the potential to relax the lower esophageal sphincter. The lower esophageal sphincter is a muscular ring that separates the esophagus from the stomach, and its contraction normally prevents stomach acid from moving into the esophagus. When ginger induces relaxation of the lower esophageal sphincter, it can inadvertently contribute to the backflow of stomach acid into the esophagus, intensifying acid reflux symptoms. This relaxation effect may counteract the positive aspects of ginger's anti-inflammatory properties, making it a double-edged sword for individuals prone to acid reflux. Number 8. Pregnancy. Pregnancy is a transformative and delicate period where the well-being of both the mother and the developing fetus takes center stage. Ginger, traditionally revered for its nausea-relieving properties, has found its way into the conversations around managing morning sickness during pregnancy. Historically, ginger has been utilized to alleviate nausea, vomiting, and dizziness associated with pregnancy. Its natural compounds, particularly gingerol, are believed to possess antiemetic properties, making it a popular choice for combating morning sickness. While many women may find relief in ginger, the question of its safety during pregnancy is nuanced. The concern arises from ginger's potential to influence hormone levels and uterine muscle activity. Some studies suggest that ginger could have a stimulatory effect on the uterus, which raises questions about its safety during pregnancy, especially in the early stages. Excessive ginger intake may theoretically contribute to an increased risk of miscarriage, though the evidence on this is not conclusive. Ginger's journey from the kitchen to the realm of health considerations is a testament to the interconnectedness of dietary choices and well-being. While the potential benefits of ginger are intriguing, a cautious and informed approach is paramount, especially for those managing specific health conditions. The collaboration between individuals and healthcare providers emerges as the cornerstone for making thoughtful decisions that align with overall health goals and ensure a balanced, informed, and nuanced approach to incorporating ginger into one's lifestyle.